for you. And brachial plexus is again an important content of the axilla. Okay, so brachial plexus is made by ventral rami of C5 to T1. It is made by ventral rami of C5 to T1. What happens somehow in as a variation in some individual, if C4 is involved in the formation, okay, normally formation is by C5 to T1, but in case if C4 is involved, it is called as prefixed type. And if T2 is involved, it is called as postfixed type. Okay. So what I have told, that normally it is formed by the ventral MI of C5 to T1. If by chance as a variation C4 is involved, we say it is prefixed type. It is a term that we need to remember. And if T2 is involved, it is called as postfixed type of brachial plexus. Now to understand the brachial plexus formation, you need to remember these things, that is RTDC. What is RTDC? Root, trunk, divisions and chords. Root, trunks, division and chords. Okay, so we have roots, trunk, division and chords. Okay, to understand the brachial plexus, we need to remember root, trunk, division and chords. So we have C5, C6, C7, C8 and T1. Now one very important point, how many cervical vertebra are there? 7. But how many cervical spinal nerves are there? 8. So these are not same, okay? Vertebra number C7 is the last number. Spinal nerve number in the cervical region C8 is the last number, okay? So we have written C8 here, alright? Clear? Now you see C5 and C6, they come together, they make the partnership and they make the upper trunk. C8 and T1, again they make the partnership, they make the friendship, okay, and they make the lower trunk. Now what about C7? It remains alone, it continues alone. एकला चलो रे, अकेला रह गया ये है ना, इसको कोई partner नहीं मिला. It makes the middle trunk. Okay, so C5, C6 upper trunk, C8, T1 lower trunk, in between only C7 middle trunk. Everything divides into two divisions. Everything will divide into two divisions. What are the two divisions? Anterior and posterior. Anterior division, posterior division. Anterior division, posterior division. Anterior division, posterior division. Do you appreciate? So what are the names of the trunk? Upper, middle and lower. What are the divisions? Anterior and posterior division. Now three trunks dividing into two divisions each. Altogether we have got 6 divisions. Out of 6 divisions, 3 are anterior, 3 are posterior. How these divisions are going to make the chords? Let me explain. This posterior, posterior and posterior, all posterior will come together to make the posterior chord. All 3 posterior divisions, they come together to make the posterior chord. Now we are left with 3 anterior. Yes. So what will happen? Anterior of upper and anterior of middle, they will run and make lateral chord. And what about this part here? The anterior of lower chord, it will make the medial chord. So it will simply make the medial chord. So this is the formation of brachial plexus. Have you understood? We started with the roots C5, 6, 7, 8 and T1. C5, 6 make the upper trunk, 8 and T1 make the lower trunk. In between C7 runs alone, makes the middle trunk. Everything divides into anterior and posterior divisions. All posterior divisions, they come together to make the posterior cord. Anterior divisions of upper and the middle trunk, they make the lateral cord. Anterior division of the lower cord, that anterior division of the lower trunk, sorry, that makes the medial cord. Have you understood all? Yes, this is the formation of the brachial plexus. Now if we talk about the root value of the lateral cord, let us now understand the root value of the lateral cord. Now lateral cord is made by this division and this division, right? This division, let us trace the fiber, this fiber, trace this fiber. This fiber is coming from C5 and C6, है ना? So the lateral cord is coming from C5, C6. Also this fiber, trace this fiber, this is coming from 7. So we can say the overall root value for the lateral cord is C5, C6 and C7. How we come to know the root value? Because we have traced the fibers, how the fibers are making the cord. Is that okay? What about the medial cord root value? Medial cord, let us trace the fiber. Let us trace the fiber C8 and T1. C8 and T1. What about the posterior cord? From C5 to T1. Why? Because posterior cord is made by all the posterior divisions, isn't it? Posterior cord is made by all the posterior divisions. Yes or no? Is that clear? Okay. This is the formation of the brachial plexus. This is the formation of the brachial plexus. All right. Now what about the branches? What about the branches? Branches are given from the root level, from the trunk level, from the cord level. But remember, there is no division from division, means there is no branch from the division part. From the roots, what are the branches? One of the branch is dorsal scapular. Dorsal scapular nerve having root value C5. It supplies rhomboideus muscle. It supplies levator scapulae. It supplies levator scapulae muscle and rhomboideus minor and major. Rhomboideus minor and rhomboideus major. Okay, rhomboideus minor and rhomboideus major. Dorsal scapular. Then we have here, you see, long thoracic nerve. Long thoracic nerve, root value C5, 6 and 7. That is for the serratus anterior muscle. That is for the serratus anterior muscle. It is also called as nerve of Bell. It is also called as nerve of Bell. Alright. So the dorsal scapular nerve, long thoracic nerve. Then also there is a branch. There is a branch to phrenic. Phrenic overall root value is C345. C5 fibers, they might go from the brachial plexus. Also, there is a branch, muscular branch. There is a muscular branch to scalene muscle. Muscular branch to scalene muscle. Okay, and the longus colli muscle. This is basically not very important, but you need to remember for sake of completion. that longus colli and the scalene muscle branches also given from the root of the brachial plexus. Okay, so these are the branches from the roots. These are the branches from the roots. What are the branches from the trunk? Only upper trunk gives the branch. Upper trunk gives the branch. What are the branches? First branch, nerve to subclavius. That is going to supply subclavius muscle only, as the name says. Second is suprascapular nerve. Suprascapular nerve. Now suprascapular means behind scapula. Okay, behind scapula we have the spine. Behind the scapula we have a spine. Above the spine we have a muscle called as supraspinatus, and below the spine we have infraspinatus. So the muscle supplied by this nerve is supraspinatus and infraspinatus. Suprascapular nerve supplies supraspinatus and infraspinatus muscle. Okay. Then after having understood the branches from the root and the trunk, let us write down the branches from the chords. So we have lateral chord, we have medial chord, and we have posterior chord. Lateral chord root value, the mnemonic is LML. Lateral chord mnemonic is LML. Medial chord root mnemonic is M4U. Posterior chord mnemonic is ultra. Ultra. Let us write down the mnemonic LML. What is LML? For the lateral chord, we have LML. What is L? Is the lateral pectoral nerve. Lateral pectoral nerve. What is this L? Is the lateral root of median nerve. Lateral root of median nerve. What is this M? Is the musculocutaneous nerve. It supplies the muscle and the skin, so that is why it is called as musculocutaneous nerve. Okay, do you understand? What about the medial chord? M4U means 4 times M and then U. What is M? These first two M can be derived from these L. Whatever we have written on the lateral side, we can use these. We will just make the M for the medial. So for example, first L we have written lateral pectoral. In the medial chord we will write medial pectoral. In the medial chord we will write medial pectoral nerve. Okay, so we have written the lateral pectoral, and in the medial we will write medial pectoral. Similarly, we have written lateral root of median. Here we will write medial root of median. So 2M can be remembered from the lateral chord, that is medial pectoral nerve. And this is medial. This is medial root of median. This is medial cutaneous nerve. Medial cutaneous nerve of arm. Medial cutaneous nerve of arm. And this M is medial cutaneous nerve of forearm. So basically you can say there are two cutaneous nerves. There are two cutaneous nerve, medial cutaneous nerve of arm and the medial cutaneous nerve of forearm, and remaining two M are medial pectoral nerve and the medial root of median nerve. Fine. What is U is ulnar nerve. What is U is ulnar nerve. Fine. What about the ultra here? Ultra. Ultra you have, this is the ultra. Upper subscapular, U is the upper subscapular. U is what? Upper subscapular. L is lower subscapular, T is thoracodorsal, T is thoracodorsal, R is radial, A is axillary, A is axillary. Fine. These are the branches names. But what about the root value? Let us talk about the root value now. See, this is lateral cord having root values C5, 6, 7. That part we have already discussed, that the lateral cord is having C5, 6, 7. So all the branches will have the root value C5, 6 and 7. What about the medial cord? Root value is C8 and T1. So all the branches will have the root value C8 and T1 except ulnar nerve, because ulnar nerve will have C7, C8 and T1. Why so? Because C8 and T1 is coming from the cord. That is okay. But what about the C7 fiber? The C7 fibers are given by a communicating branch from the median nerve. So basically, median nerve gives the C7 fibers to the ulnar nerve. Altogether, ulnar nerve root value becomes C7, C8 and T1. Okay. What about the posterior cord? Root value is C5 to T1. C5 to T1. But although the posterior cord root value is C5 to T1, only radial nerve is having this root value, that is C5 to T1. Else other all nerves, they have different root value. These two are having C5 and C6. Axillary is also having C5 and C6, and the thoracodorsal is C6, 7 and 8. So for the posterior cord branches, we need to remember that what is the root value. Otherwise, it is very easy to remember the root value for rest of the brachial plexus anywhere. Okay, so these are the branches of the brachial plexus with the root values that you have learned. All right, have you understood? Only one point that we may write here. What are the muscles supplied here? We can write the muscles supplied. Upper subscapular is going to supply which muscle? The subscapularis. And the lower subscapular is going to supply? The lower subscapular is going to supply subscapularis plus teres major, plus teres major. Thoracodorsal is going to supply latissimus dorsi. What about the axillary? Axillary is going to supply deltoid. It is going to supply deltoid plus teres minor, plus teres minor. Okay. So these are the muscles supplied by the individual nerves. All right. I hope everything is clear to you. Yes. So we will keep today's discussion up to this. Tomorrow we will begin with the lesions of the brachial plexus, and then after that we will be discussing the regional study. Regional study means the pectoral region, the shoulder region, the scapular region. Like this, we will be looking at the regional muscles and their attachments and all. Okay. So this is how we need to proceed, and this is how we are going to learn. All right. So we will keep today's discussion up to this. Have you understood everything? Yes? All right then. Thank you very much everyone. Okay. Good night. We'll meet on the next class with the continuity from here only. All right. Thank you everyone. God bless you all. Good night. If you have any doubt, you can ask. Okay. During the classes, at the end of the class, you can ask. All right. Or else we will keep some doubt session just like the post class test on the day of test discussion. That test discussion day is also the doubts clearing day. That can also be utilized. Okay, so we will be utilizing these classes, the doubt clearing sessions. Okay, all right. Take care, everyone. Bye bye. Good night.